it's a lot of fun doing this because you see people get better. And that's what I try to tell. I've tried to tell doctors for 12 years since I started doing this. It's like, well, I know the science isn't there yet, right? But the experience that physicians have reported for over 70 years is all pretty positive. And these are not unreasonable people who have reported this. One of the ones who convinced me to try prolotherapy was C. Everett Koop, who is the Surgeon General, right, under Reagan, and you know, and he's a very conservative guy. I mean, he's open-minded, and he's not an ideologue, you know, but he's very conservative by nature. And he actually had prolotherapy in the late 50s, early 60s. He had a sacroiliac joint problem. He had referral of pain down the leg, which is commonly called sciatica, right? But it wasn't from a herniated disc like everybody thinks. A lot of that pain going down the leg is not from a disc. It's not from a pinched nerve in the back. It's from ligament weakness in the pelvis, or from trigger points, which are tight muscles, like in the gluteal muscles, like in the side of the hip. And so he had chronic pain for 2 years, and he was a young surgeon. Young, you know, he's 40 years old, which is, to me, is young now. But and he was having trouble getting through his operations because he's leaning over the table, and he'd start getting this pain down his leg. And so he was actually at a Christian Medical Dental Society meeting and ran into this guy who was talking to him, telling him about this pain. Oh, it's been 2 years. I've been to multiple pain specialists, doctors, and they all tell me, well, you're getting old. This is what happens. And that other doctor was like, well, tell me more about it. He said, you know, it really sounds like it's from your sacroiliac ligaments. I bet I can cure you. And he did. So he had to fly to Chicago to get treated. He was working at University of Pennsylvania, Koop was. And it cured him. So then he was like, wow, why isn't this standard medicine? So he followed the guy in his clinic. This was Dr. Himwall. And watched him treating temporomandibular joint problems, and rotator cuff problems, and tennis elbow, and wrist sprains, and knee problems, and hip problems. And the vast majority of people that were coming in were, oh, I've had 2 treatments, and boy, I'm doing a whole lot better. And he was so frustrated with his colleagues because they wouldn't believe him. You know, other doctors that he would interact with in the hospital, he'd tell them about it, and he said, you know, they wouldn't listen, basically. They didn't want to hear it. Which always amazed him, and it still amazes me. Why don't you want to hear about people healing from things that? And it's, you know, part of it is doctors are conservative by nature. We don't want to take risks that are unnecessary, and we want to believe that our training taught us everything that is known, and that, you know, advances will come from new technology, from new scientific insights. Advancements don't come from looking backwards, right? And yet, there's a lot of natural things that have been ignored for decades. And this, to me, is the one that convinced me to be more open-minded about all kinds of other things. I still want to be conservative and not do anything that's dangerous, but if something is unproven but completely safe, and someone has a chronic problem that standard of care medicine is not helping, why not encourage them to try it and learn from their response?